Okay, well, hello, everyone. Thank you so much for being here today. I'm grateful that you were all able to make it in on a Saturday afternoon at 2 o'clock. I know I'm sure you all want to spend your Saturday listening to hospital and county business, but I wanted to make sure this was as accessible as possible for the public, something I value very much as the District 4 supervisor. So yeah, we'll get started here. Welcome everyone again. My name is Jenny Kaiser. I'm the Mariposa County District 4 supervisor here in Mariposa. I'm very proud to serve as a community leader here. So grateful that I was given the opportunity to do what I'm doing today specifically. I ran very eager to create synergy within our community. So excited to highlight a couple of amazing leaders who are really leading the charge and trying to bring our community together and create a successful healthcare system. There's a lot of people involved in this, actually. So anyway, I'm off script. I'm going to get back to my script here. That happens to me a lot. So let's see here. Where am I? Get back to my spot. I know, that's what I do. So a little bit about my background. I hold an undergrad degree in psychology from UC Merced and a master's degree in conflict studies from Fresno Pacific University. Healthcare in our community matters deeply to me as someone who has personally utilized many of the different services. You're going to hear, we have a variety of different services that offer healthcare here in Mariposa. As a mother, as someone who is currently taking care of an elderly father who's home on hospice right now, JCF has been instrumental in the well-being and of my father's care. So I'm very grateful to them for that. Also me and the services that I may need to access here in Mariposa. In a rural community, that can be tough sometimes, right? So I think what I want to see is a system where we are all communicating, collaborating and supporting one another so that as few people as possible are falling through cracks. And yeah, I mean, I think from our mental health services to the swing beds at JCF come to mind simply because of an experience I had with my father. I had been sleeping with him in a emergency room in Merced when someone local here discovered that that was happening. We got to pull him up here to Mariposa. They were instrumental in that, and they put him in a swing bed. He was close to home. I got to go home at night, come back in the morning. Very grateful that that's here. Don't know who knows that that's an option here, right? We also have, lots of primary care services. You have the Community Health Centers of America. You have the MACT Center also. They have a variety of services. And then we have our own HHSA, and Christina Kahili is here today. She's our HHSA director. Joe Lynch was our HHSA director. So behavioral health, lists of services that they provide. Yesterday, I had an opportunity to attend a really productive meeting where partners came together to talk through what each organization is offering. And it was all of those organizations. The only one that was missing was Yosemite National Park, and they just couldn't make it. Stacy and I, and Stacy Lynch, I don't know where she's sitting, thank you, did have the opportunity to go up and spend some time with the superintendent of the park, figuring out what gaps all of these services can help to fill up there as well. So this meeting was put together by Rose Fluharty on the hospital board. I think she was supposed to be here. I don't see her. Is she here? Oh, she's on Teams. Hi, Rose.
Hi, Jenny.
Yeah, hey. Oh, that was cool. So it seems like Rose and I have a very shared vision, and we got a chance to chat a little bit about that. So coming to the meeting yesterday with her was nothing short of inspirational, to say the least. And these folks all got together and they talked about what's missing and how they can support one another and reestablish relationships, things I value as your county supervisor. Again, big thanks to you, Rose. Grateful to you, excited to do any work alongside you. It's weird not having you here to look you in the face, but in this realm. I also want to take a minute to thank a few people who helped put today together. Danielle Bonshu, our clerk of the board, very instrumental at Saturday. She's here. She's participating and making it all happen. Jean, who is our county PIO. Thank you so much, Jean. She did a lot of work on this to get the social media out. And that social media comes down to 1/4 of an inch of how you move things around on the page. and I screwed up all the time. So thank heavens for her. And then, of course, Zach, who is the JCF's PIO. So without them, this would not have been possible today. So a little bit about the formatting for today, so you guys know. It's going to start off with a guided presentation, and then we're going to open it up for a Q&A so we can hear directly from all of you. So I'm grateful to be a part of this, not just as a supervisor, but as somebody who believes deeply in servant leadership and in the power of community. In Mariposa, when things get tough, we get creative. And truthfully, that mindset shouldn't just show up in hard times. It should be how we just generally operate in a rural community, to be supportive of one another. Silos aren't the answer. Fear shouldn't drive our decisions. Reality, collaboration, and creativity should. And I'd like to see that be just the norm and not when things get hard. So thank you again for being here and being a part of the solution. We're going to start off today with Stacy Kuzek, who is the CEO of John C. Fremont Hospital. And I'm going to introduce her to all of you. So Stacy brings a really unique and powerful combination of experience to our community. She's a registered nurse with both a master's of business administration and a master of science in nursing. That means she doesn't just understand healthcare from a clinical perspective, she understands the business side of it too, which is critical for rural hospitals like ours. She started at the bedside, working directly with patients, and worked her way up through leadership with a strong focus on quality, patient experience, and operations. She's also worked in a federally qualified health center, where she gained valuable experience in healthcare, finance, while overseeing nursing and clinic operations. Since joining John C. Fremont, Stacy has taken on a wide range of responsibilities, from quality and risk management to revenue cycle, compliance, and medical staff operations, which ultimately led her to the role of CEO. In that role, she's focused on strengthening the hospital's performance, building strategic partnerships, pursuing grant funding, and making sure we are serving our community in the best way possible. But I want to take a minute to share what I've experienced personally working with Stacy so far. She's open, she's honest, she's incredibly forthcoming, which really matters. She answers her phone, she makes time for community partners, she shows up, and she's not hiding behind a title. She's willing to be the face of the hospital and be present in the community. We've needed that, and I think we all would agree that that's been, these guys come in and we don't know what's going on, and that is not what this woman represents. I can promise you that. She's also very intentional about building and rebuilding relationships, which is something, of course, I value deeply. And from what I've seen, she works cohesively with her board and is really focused on moving things forward in a thoughtful and collaborative way. At the end of the day, Stacy is here because she cares about patient care, about her team, and about making sure our community has access to the healthcare it deserves. There's a lot of work ahead, but she's committed to it, and I'm grateful she's here. Please join me in welcoming Stacy Kuzek to the podium.
Now I'm getting my cheat sheet. Good afternoon, everyone. Thank you, Jenny, so much for the introduction. Again, I'm Stacy Kuzek. I'm the CEO of John C. Fremont Hospital District. And I've been in this role for almost 5 months now, 5 months. And it has been a journey so far, and we have a long ways to go. But I am so excited to be here, and I'm grateful, and I appreciate the opportunity, and is my commitment to continue to stand here, to share what we're doing, to not hide behind a title, as Jenny said, and really see this hospital through. So I'm going to start off with just a patient story, because I think that bringing the patient focus to these conversations is imperative. So why this matters. So in February, my husband was hospitalized at your hospital for over 2 weeks. He was given the best of care. There was a wonderful nurse that gave him such wonderful care. She was so compassionate. Her name was Rose. I was so pleased that she gave him the care she would have if he was her father. She was so efficient and always had a smile on her face. And that was a story from a patient's wife that wrote in. And what's really important here is that I understand that there's been challenges and there's been distrust and there's been erosion. And there's many stories that people are not happy about with John C. Fremont. But I do want to celebrate the small wins, and I do want to recognize the people for their challenges and say that I'm sorry, and we will continue to do better. And then also thank the community for continuing to give us the chance as we improve all of our processes. And I think also I want to say it's really important today that I know that I've heard in the past that the county, the hospital, school district, people have tried collaboration. They've done this before. And so also through the question and answer session, I'm really interested to hear on what we've tried before, what's worked, what hasn't, and what new things that we can bring to the table through this process. Like Jenny said, just a little bit about me. I am, sorry. Next slide. Sorry, I'm like, okay. It's just, again, a little bit about me. Nurse by background. As Jenny said, I won't get too much into that, but I am extremely patient-centered. And I really believe in that. As a nurse, I care for people. I care. I want to do the best I can. I focus on transparency. So being honest, having integrity is extremely important. Holding a nursing license, it is extremely important that you focus with honesty and integrity. And then again, my commitment to all of you for our community is imperative. Next slide, please. Okay, so I will get into a little bit about John C. Fremont and the current services. So our current services we offer are 24/7 emergency services. We offer inpatient and skilled nursing, primary and specialty clinics, imaging and lab, procedures and infusions, and I'll get into a little bit more about that. We also offer our Ryan White program, and we have what Jenny called is our swing bed program and capabilities, where patients can, they're either admitted at John C. Fremont, they can say they're going out for surgery, for orthopedic surgery, and then come back to John C. Fremont to recover so that they don't have to stay so far away from home. In our clinics, just a little bit of overview of our clinics. We have 3 clinics. We have Fremont Family Physicians, we have our specialty clinic that it's across the street, and then we also have our North Side clinic. And within our clinics, we do not have all full-time providers, but we do have 5 providers and 3 nurse practitioners in our Fremont Family Physician Clinic. And then in our specialty clinic, we have a cardiologist, Dr. Singh is our neurologist, Dr. Parikh, rheumatologist, Dr. Horvat is our endocrinologist, Dr. Cole, dermatology, and Dr. Lagahi is our gastroenterologist. And then in our Northside clinic, we have Kristen Fournier, who is our family nurse practitioner. And just a little bit about the services we offer as well to our Ryan White program. It is a HIV/AIDS program, which provides comprehensive support services for people living with HIV. And that is run by Sean Aiken. And thank you to the county. We were going to move that program back to the county. And we asked Joe if we could please keep the program, keep it under us. And we're very, very thankful for that and to keep Sean with us. So thank you, Joe. and Stacy. And our emergency department, we have 8 doctors, and our medical director there is Dr. Cardillo, and we have Dr. Minyard, Dr. Sharif, Dr. Benson, Dr. Light, Dr. Clark, Dr. Ali, and Dr. Shaw. And then in our inpatient, we have 2 physicians that are a hospitalist team. So if you do stay In the hospital, you will be met with either Dr. Barzaga and Dr. Hazrati. They are married and they provide our hospital's inpatient care. They have been just extraordinary in increasing our census, which has been an extreme help. We used to admit 2 patients, 3 patients. We are now sometimes at 15 patients. So thank you to the community for believing us and coming to John C. Fremont for care, and then also to Dr. Hazrati and Barzaga for really caring for the patients in the community. And then just a little bit about our Ewing Wing, our SNF, or our skilled nursing facility. Lots of people, talk wonderful about the skilled nursing facility. It is. The staff's amazing. Our patients are amazing. We have 16 residents. We have a profit actually at the Ewing Wing, and that's great for us. And we have just recently passed our regulatory compliance, our relicensing surveys. And so that has also been a great win. And thank you to the team for all of that hard work. Dr. Carter is our medical director at our SNF, or our skilled nursing facility. And we are looking for strategic vision of expanding our skilled nursing facility in our new hospital. Or master planning, I should say. And then just a little bit more about our swing program. I don't know if everyone is aware of it, our community is aware of it, but we do like to discuss this just a little bit. So we call it a Bridge to Wellness program, which supports people who no longer require acute care, but are not yet ready to go home. And it is Medicare certified, and it's after qualifying a 3-day inpatient hospital stay. So we're really trying to help those in need here in our community, stay in our community. Family members can come visit their loved ones in the hospital and not have to drive to Fresno or Modesto, Merced to recover. Okay, next slide, please. So access to care and services. So it is really important that we keep our services here in Mariposa. I understand that it has been challenging to schedule at the clinics, and we are improving that. We are working daily on that, trying to figure out, as we get more providers, reduce the wait times, the schedules, how can that work, be innovative in all of our scheduling, because we know that scheduling has been a barrier in the past. Reduce wait times. You don't want to wait 3 months to see a provider, and I understand that. So growing our providers, having more availability is a process that we are currently working at. Expanded services. So we're trying to figure out how we can expand our services. What services do we need? What are our largest referrals? So that we can keep that service here in the community so that people don't have to drive elsewhere. Clear communication. When I started in my role, I could definitely see that there was a lack of communication, that we need to communicate more and we need to share our services. And so having Zach here as the public information officer has been extremely helpful. And we continue to communicate out about John C. Fremont, what we can offer, listen to the feedback, make changes based upon the feedback. And so that is imperative as we grow and improve our processes. And then again, like I said, just access to care would also mean care closer to home. Next slide, please. So building the future. This is a topic everyone asks about. So I have a few slides and then I'll get into a little bit of information. So this is what our future hospital will look like. We've had this on board meetings and it's been on the media, but just to bring up, this is our exterior. Next slide, please. And this is the side of it. And the ER will be kind of on the back end of that, around the corner there. Left side. Next slide, please. And this is just a more of the blueprint there, and you can see where the proposed hospital up top. I know, I'm like, you can Vanna White it. Yeah, so there, so Jenny can Vanna White it. Um, Nope, I'm good with my glasses. Not sometimes. So anyways, this is our proposed hospital here. And then I have another slide next, but we'll talk about the master planning that will all come around down here. And so, oh, no, that's okay. Don't worry about it. So the hospital itself, the new hospital will be 22,000 square feet. And then again, like I said, I have a little bit more detail in just a moment here. Next slide, please. And then we've worked with the foundation and different community partners on some of the plants and the landscape and the master gardeners, what that's going to look like, and getting feedback. So we're not there yet, but we will be getting more into keeping native plants in the hospital, you know, around the hospital community. I know that's very important, so we want to make sure that we honor that as we talk about the landscape and what that looks like. Slide, please. And then the future. So not only are we planning to build the new hospital, but then after the new hospital, what else? And so we're looking at a master plan that will build the rest of the other areas of the hospital out that are existing now. And we've had 4 strategic meetings about it. The public has been welcome to those meetings to give feedback. There'll be a lot more information as we move along, but this won't be happening until after the hospital is built. And so we're in between the 2 exhibits, Exhibit C and E. We're talking to community staff, getting their feedback. And so this is very preliminary, but we did talk about it in our strategy sessions with the public. And I wanted to make sure that I show it here for the people that haven't been involved. It is on our website or in our meeting minutes. So please, please feel free to look and see, and you can always comment, and we're welcoming comments, feedback. Okay, so next step. So just some detail about the hospital. Okay, so the design. So the interior and exterior designs are now 90% complete. We did complete the exterior design and then just the interior, just working on some small revisions. We plan to resubmit the plans to HCI in early May. And then our schedule. So for our first round of HCI plans are review and complete. HCI is experiencing an overwhelming design review request from other California facilities seeking the 2030 seismic compliance. So we're not the only hospital. There's multiple critical access hospitals that need to meet the seismic requirements by 2030 as well. So they have an overwhelming backlog of plans and approvals. And so we're right there in the middle with all the other critical access hospitals now. We have done our environmental planning, and that is all complete. And then our Mariposa County major design review has been approved. Okay, thank you. So funding. So we are currently in the process of working with USDA on our feasibility study. So we are currently doing our feasibility study and working with USDA loan on what that looks like and all of the associated requirements. There's different requirements now than there was a year and a half ago. So we're just working through all of that as we stand today. And then just a little bit more about this. We do use for our funding, we use our Measure O funds, and I have a little bit of information on that for the new hospital. And then just some potential expanded services, because I know, we've had a lot of community input about that. So just want to make sure that we publicly recognize that. We're looking at pediatrics, women's health, podiatry, dialysis, infusion, maybe some oncology, and outpatient physical therapy. Next slide, please. So what does this mean for everyone here in Mariposa County? More specialty care locally. Less travel out of town. That is the goal, so that our residents, our community does not have to travel out of town to receive services. Improve patient experience, and then stronger long-term access. With kind of the evolving partnerships with I would say the county, and just working as a team, I am, there's outside communities that are, asking about the hospital, and providers asking how they can provide services here in Mariposa, like 2 days a month, or specialty providers, and what can we do? And so that's really exciting as we talk about provider recruitment and better access to home. Okay, next slide, please. Measure O funds. Okay, so just a little bit about the Measure O fund. So Measure O fund is a voter-approved local sales tax measure. And this money is used for the new hospital build. And the money is restricted, and it's meaning that it can only be used for purposes approved by the voters. So it can be used for capital projects, infrastructure planning, and construction-related costs. So every month at our board meeting, we do present a slide on Measure O funds and what that means, and how much money is in our Measure O funds and what we've used them for the month. So we will continue to do that every month, so that the community is aware of what we're using them for and how much we have left. We currently have 9.3 million in our Measure O funding as 1/31/26, but we have more. I don't have the exact number. I'll have it next week at our board meeting. But okay, next slide, please. So financial outlook and sustainability. This is everyone's question. This is always the more challenging question, because there's been a long-standing financial loss at the district. And when you're looking at that long-standing loss, you think, how do we do this? Like, how do we turn this around? What are we going to do? So in my almost 5 months here, I've identified that we have a lot of things that potentially, we're not industry standard on, or we have lots of systems that have to connect to make our billing optimized, paperwork with CMS, surveys with CMS. There's many things. Since being here, we've had 5 CMS surveys. That's a lot in just a little bit of time. And so when we're talking about financial outlook, it's getting in there and fixing true foundational things that need to be fixed, that have been needing to be addressed for a long time. And I think for John C. Fremont, which I'm right there along with it, is it's always, how can we get cash in the door, right? I mean, because we need revenue. But with that also, it's how do you get cash in the door, but how do you fix long-term things that keep industry standard, bring us up to industry standard, so that we can grow and we can capture our revenue to the max, to optimize our revenue. So we are at a current operating loss, and we are doing everything that we can to fix foundational pieces, looking at every piece, every area, and really figuring out our expenses and our revenue to make sure that we understand it, each department head to understand their department, their expenses, where they can help support our revenue. And so it's the entire team coming together. I will say that, our volume, so our average daily census, that means how many patients are in our hospital a day. It's at 9.9 on the average. And it used to be 5 and 6. So our volume has increased. Our ED visits, we see over 7,000 patients a year. So thank you to the community for trusting us and using our services. Our clinic visits, we're up over 1,500 visits a month. Again, thank you to the community for trusting in us, coming back to us. But we understand, and I understand that we have to figure out our increased volumes and our revenue and what's happening in the revenue leakage. So I have more to come as we discuss at board meetings and what that looks like and plans around that. But that is where we are at today. There's risks. And again, I'm talking about honesty here and transparency. So again, the persistent operating loss, our revenue leakage. So where are our systems not talking so that we're not maximizing our revenue? Our volumes, we have to continue to grow our volumes. Rising costs. So insurance payers are paying less than they were even a year ago. Supplies are more expensive. And it is something that hospitals are facing across the nation. And then just relying on one-time funding. We need to figure out, and we are figuring out, how to sustain without government funding in order to home grow and then grow our services and maximize on our revenue. So it's just some 90-day priorities. Continue to work on our revenue cycle. We have to control our expenses and working with our leaders on overtime and just payroll expenses and our supply expenses and helping our internal teams understand what that means. Growing volume and then, of course, preserving cash. Next slide, please. Okay. Sorry, I'm one ahead of myself here. So key improvements underway. So not only do we need to focus on our revenue and our financial status, but in order to have a hospital and clinics and healthcare, there's a lot more that goes into it. And so we are focused on patient safety and quality. We have to provide safe, quality care. And so there's a lot of work happening around that with quality and safety. We have our Chief Nursing Officer here today, Rachel Key. Thank you for being here, but she is spending lots of time working on quality and safety. It's imperative. Our new payroll system. We've had challenges with our payroll. Employees have been very upset about our payroll for several years. When I got into my role, I recognized that, and I want our employees to trust us. It's very important, and I felt there was distrust. So we are implementing a new payroll system. And our Chief Human Resource Officer is here, Rachel Jones, and thank you for working on that as well. Again, just another key improvement is our revenue cycle, looking at every single area. Is our paperwork right? Did we register things right? And very, very foundational pieces in order to maximize on every single piece of your revenue. Employee engagement. Zach, thank you so much. But really working on employee engagement. It's really important that our employees understand that we're here to serve the community. Like, I'm grateful for my job. I'm grateful for the community. And I want our employees to understand that as we ask community to come back, we are here to serve everyone as well. So, reinvesting in our employees, helping them feel valued is imperative to this process as we work together. And then again, provider and recruitment, because we have to grow our volume. Okay, next slide, please. So just a little bit more on community and funding and grants and what that looks like. Um, in our current state, it is imperative that we take the opportunity to work with our partners and engage in grant funding and help support us. And so we have definitely worked with Central California Alliance, our managed Medi-Cal plan, to receive provider recruitment grants, a healthcare technology grant that we were approved for, and then a workforce support grant. So to have medical assistants, like I said, some nurse practitioners, some of their wages be covered to help serve our community. And then some pending and upcoming grants. We have a Medi-Cal outreach and retention grant that will bring community health workers to our district and help the community register for Medi-Cal, and then also help with some chronic care management. And then also the community health worker recruitment that again will meet with patients and help educate them on their comorbidities and really help work on some preventative medicine in our community. Next slide, please. So workforce development. So I also understand that it's imperative that, like Joe says, when we met one day, he said, it's county education hospital. And he really made me think a lot about that. And what does that look like for our younger generation, our high school students? How can we provide them opportunities? Can we keep employment here at home? And so really wanting to partner with school districts, grow our students, offer some programs from the high school to our hospital. Also engage in some training programs, certified nursing program. We are waiting to hear if we receive a grant for some of this process work with our school district, and then also engaging with Merced College for some training, some internal education, providing our employees some customer service training, and then also our leaders as well, providing them with emerging leaders, conflict resolutions, and growing our community's children, and then as well giving our internal staff some resources and education as well. Next slide, please. And then just real quickly as well, our hospital foundation has also been a great partner as well, as we're talking about partnerships here in the community. And just want to say that in recent years, we've been awarded $27,000 in scholarships and grants to strengthen and expand our local healthcare workforce. So it's been really neat to see that our nurses or our CNAs have been able to grow internally here and get awarded from our foundation to be able to go to school and grow their careers. And then also JCF has purchased over $90,000 in critical care equipment to improve patient care. That's huge. A new ventilator, IV pumps, lots of many things, defibrillators, wheelchairs, staff break room, all kinds of things to give back to the staff so we can give back to the community. So the partnership is amazing, and thank you for Miranda Wass is here today. Thank you, Miranda. But you know, Miranda and Zach are spending lots of time together figuring out how we can engage our community as we work through this together. So thank you. And then why I'm here today. So county and district collaboration. I think that it just really was so important, and to recognize the fact that the county has services, we have services, and when you don't talk, there's silos. We're missing people We're missing helping serve our community. And so it's Joe and I have been talking. Definitely his vision matches my vision, and it's an overlap between the county and the hospital, and then education as well, but an overlap. And I know Joe has more about that, but to make sure that our community and our people don't fall through the cracks. So working closely with county leadership. Like I said, I touched on this, coordinating on community needs. So aligning healthcare and local resources. The other day when Stacy Lynch and I were together, she was a wealth full of knowledge. Thank you, Stacy. She had so many things that I feel that I'm like, wow, we really need to work together. I need to lean on Stacy for so many things. And so I think just that partnership to continue to grow. And then just beyond everything is a shared commitment to Mariposa. Next slide. And I said, breaking down silos. So we have to improve communication across our organizations. And our commitment to you. So the commitment to everyone and who's on teams and in the audience. We have to improve our patient experience, improve our quality, deliver safe quality of care, strengthen our community and our communication, and stay accountable. So this is a start. This is a fresh beginning. This is a new foundation. We have new leaders in our hospital. We have new departments. And this is a source of truth today. And that is my commitment, that I stay accountable. And this is my commitment to all of you. And next slide, please. That's it. Thank you very much.
Thank you so much, Stacy. We really appreciate you coming up and talking. I couldn't agree more. Yeah, the silos are a thing, guys. We've got to continue to bring these people together. We have one constituency base here that we serve, and it's going to be key to the success of this hospital, amongst the success of every human life that lives in Mariposa County that needs healthcare services, whether it's behavioral health services, medical services, elderly services, transportation services. There's so many ways that we can work together as a team. Even between Mariposa County and Madera County, there's a variety of conversations going on. We can't be siloed. We can't be. It's just not working anymore. So with that, you can see on the screen, well, never mind. Okay. Oh, there it is. It's back. Joe. That's what I have to say. You guys are going to hear from someone who is so incredibly dynamic in his role. And we are so incredibly lucky to have him in Mariposa County to lead this county. Someone who I have a lot of respect for, who works really hard every single day to make sure our county is running in the direction that it needs to be run, which is efficiency, which is encouraging our department heads, creating trust amongst our departments, and so much more. And to be on this board and have someone, I mean, when I ran, Dallin was here. I'm not going to bash on anybody, but boy, am I glad I got here when Joe was here. That's what I have to say, because he wants nothing more than to build trust between the community and our government, as do I. So I'll talk a little bit about him. Joe, aside from all that, Joe brings us both strong education and real-world experience to his role. He holds a Bachelor of Science in Business Administration and a Master's of Public Administration. Professionally, Joe spent 27 years with Target Corporation, where he ultimately led operations for 77 stores in the New York City metropolitan area. That level of responsibility speaks not only to his leadership, but his ability to manage complex systems, large teams, and high-stakes decision-making. But what stands out most to me about Joe isn't just his resume. It's how he shows up here in Mariposa. Joe is deeply passionate about this community. He and his family live here, and that personal investment shows in the way he approaches his work. He's not just doing a job, he's contributing to the place he calls home. In working with Joe, I've seen firsthand his ability to build trust between departments, especially during the budget process, which is no small task. He's a clear, thoughtful communicator, someone who can break down complex issues and approaches them with a critical, balanced lens. And beyond all of that, he brings a steady, grounded presence to the work, something that matters more than ever as we navigate important decisions for our county. If you would, please join me in welcoming Joe Lynch.
Good afternoon. I'm Joe Lynch. You just learned that. So I promise to follow the 3 B's of public speaking. I will be brief, I will be good, and I'll be gone. Because I know most of you are here for the hospital. However, I should also let you know that I will not be deep diving into programs today. I'll be talking more about the macro level. However, with me today is Dr. Christina Kahili. She's our Health and Human Services Director. They are the #1 health provider from a county perspective. And Stacy Lynch, who is our Division Director of Healthcare Services and also our local mental health director. So during the Q&A, should you ask questions, they may take the mic and answer. They don't know that yet, but it's possible. So we'll go ahead and get started. So I wanted to discuss what's important and why we're here today. Mariposa County has 3 main entities. Now you may say 4, Yosemite, but Yosemite's kind of always been here. And even with Yosemite, the population's going down. So that means the other 3 entities, which is the county government, the hospital, and the school district, are important for the infrastructure in Mariposa County to make it somewhere that people not only want to live, but can thrive. I think as Supervisor Kaiser mentioned, I have 7 kids. And I didn't have them all, my wife did. I have 7 kids, but the first one went in the military and came home. The second one left and never came home. The third one will never leave. The fourth one's going in the military in 2 months. So what's happening is almost 50-50, my kids are either staying or leaving. So how does someone choose to make a decision to live in Mariposa County? The 3 things that I mentioned, if you've ever moved, the first thing you say is, how's the school district there, right? If you've ever moved towns and you have a family. The second is, what's the infrastructure look like? What do the roads look like? The post office, is it easy to navigate? Is it safe? Is there law enforcement presence? And the third is there a critical care hospital? Is there somewhere I can go when something happens? So we have those 3 things, but we haven't always necessarily worked well together. You can go ahead and go to the next slide. So right now, the big 3 really meet infrastructure needs in Mariposa County. It comes from education, it comes from health and human services programs, it comes from public works safety, all the things that are listed. But the one I added up there was disasters. Where we are at our best is our disasters. So you think of the Oak Fire, Detweiler, Ferguson, COVID. When we had these scenarios, all of these entities came together to provide a service for Mariposa County. I remember COVID. This was back in January of 2020. You guys don't remember COVID like me? I don't know, COVID. January of 2020. Dr. Eric Surgenko, who was our public health officer, had a meeting at the Health and Human Services Department. He called the school district, he called the hospital. We had all of our government, our inner government there, and we discussed what was this going to look like. And we were all like, what do you mean? There's 6 people on a cruise ship off of San Diego. Why are we worried about this? At this time, there were 0 cases in America. And he thought it would be a really good idea to make sure that the hospital had the PPE they needed and the school was ready with masks and everyone knew what to do. Well, March 13th, just a couple months later, everything closed. Mariposa had PPE. We had guidance for our businesses. We had guidance for our schools simply because we worked together. If you think about the Oak Fire, all of these entities come together to provide services. The problem is, that's when we're at our best. It's the time between those disasters we haven't been great. So we spend a lot of money in this county. I don't know if you knew that or not. Probably more than $250 million annually is spent in federal and state funds in Mariposa County every year. And the only way to make that effective is if we do that together. I mean, I'm sure you've, in personal lives, you're going to build a fence and your neighbor's going to build a fence. You don't build 2 fences next to each other. You kind of pull your money and put 1 fence in. Those are the behaviors we weren't doing. And those are the behaviors that we're looking to do. Why that matters You don't go to the next slide. Hang on. I'm just saying why that matters. She's got cues, and that was one of them. Why it matters is because we have the ability to have effective use of funds. And I'll give you a classic example. We talked about, I think Stacy talked about transportation and out-of-town services. Health and Human Services, I'll see if I get close to the number still, spends about $1.5 million a year transporting seniors to medical appointments in Madera and in Fresno, Merced, and there's some way further, Turlock, and even further out, right? So here we are spending $1.5 million of Health and Human Services money to send people out of county to get their services, and that's a drain. It could be used somewhere else so much more effectively. So those are the moments in the past where we worked with the hospital, we worked with the school district and said, hey, we should do something. And in the past, it wasn't heard. As Stacy's come into role, as whether Stacy's working with Stacy or Supervisor Kaiser or Christina, we start to go, it doesn't make sense. Let's start pooling our funds together to enhance the services that Mariposa County gets. That's why this is important. That's why we're here today. The cohesiveness of the three entities is essential to provide the best services in Mariposa County. Now, without relationships, we still provide services, just not as effective. We're a small community. $250 million is a lot of money. We should get our services that we pay for. Well, we don't pay for all that money, by the way. I don't think the collective taxation of Mariposans equals close to $250 million or $300 million a year, but that's what we spend every year. Okay, we'll go to the third. So what we intend to do, and as we've done in the past, and we will continue to find avenues, is we will look for ways that we can find out from the community what you need and give you the quickest access to that resource. So I'll give you an example. I don't know if you knew this or not, but Health and Human Services does physicals. The hospital does physicals. The school does physicals. Where do you go? Wouldn't it be good for us to say, hey, if it's this type, go here. If this type, go here. If this type, go here. So that the public has really clear information about all of their services and where you can get services done very quickly. True story. My daughter, Josephine, is on the varsity softball team, Mariposa High. And she needed a physical. She came home one day and she said, hey, if I don't have my physical by Monday, I can't play. And we're like, thanks for the notice. That's teenagers for you. We've seen a few in our house. And so it was like, where can we get a physical? And here, I used to run Health and Human Services. I'm sitting there going, where can we get a physical? And my wife says, well, there's a number of places you can go. And I was like, oh, really? Tell me. And she did. And we ended up getting my daughter a physical at JCF. I wasn't even aware that they did physicals at JCF. I was the Health and Human Services Director for Mariposa County. Does that make sense? This is why this is important today. The other one is the ability to, I'll just skip to the last one, is the ability to go after funding is much more strong when we're partnered together. And I'll give you a really good example. The school's not here today, but the school district was having a lot of issues with bullying and the impact on children in school. And Health and Human Services was able to secure a grant for their mental health services at the high school. They weren't even aware that the grant was available. So we went to them and said, hey, we have this grant available. And they said, we don't have the capability to even go after it right now. I said, well, can we go after it for you? And they said, sure. What was the amount? 2.8 million or in that range. So it was 2.2 million over 3 times. Yeah. So I haven't been at Health and Human Services in 2 years. And that means I don't know anything anymore because times change so rapidly. But so it was over $3 million in mental health services for our school kids that the school didn't have to use their budget for. Health and Human Services didn't send their staff for. It was actually unique new funds for Mariposa County. So our ability to find the gaps in services for our population, the gaps in services for our infrastructure or for our hospital, and then work together to find out who's best to apply for it, how we work together amplifies our ability to do services in Mariposa County. Now, I can tell you this, each of the three has had good and bad times. I can assure you the best times come when we're together. When we haven't been together, it's not been so great sometimes, except for disasters. But I don't want to wait for a disaster for us to be a team or be partners or to provide for the community. And so that's why it's important to me. I'm in my last job. I'm going to retire in Mariposa County. I'm never leaving. Sorry, in case some of you want me to leave, it's not going to happen. But I care about this community, and the things I don't do for any other reason than to feel proud of Mariposa, to have services that we have for our constituents and our kids and keeping them here, and hopefully change the decline into a growth in population where it becomes a place where people look to and say, they got it all sorted out there. It's a good place. When they ask the question, do they have a school? It's a great school. Do they have a hospital? It's a great hospital. Do they have great infrastructure? They have great infrastructure. That's my goal. And that's what I intend to do till I retire. Now, in the beginning, I promised you the 3 B's. Be good, be brief, be good, be gone. I don't know about the middle one, but I'm doing the front and last. So that is all I have for today. I will turn it back over to Supervisor Kaiser, and we can go into questions and answers. Back. Thank you.
Okay, thank you so much, Stacy and Joe. Today really is all about these guys, and so we're going to open this up for a Q&A. Zach's going to help. He'll grab the other mic, and I'll have a mic, and we will walk around and answer any questions you guys may have as it relates to these two incredible leaders here in Mariposa. Are you ready, Zach? All right, here we go. I don't know how to turn this on. Oh, wait, it's not rocket science. All right, who's first? Who's got a question?
Check, check, check.
Can you hear it?
Test 1, 2.
There you go.
Is it on?
Michael.
Keep it close.
Thank you for coming and speaking with us today and sharing such great information. My name is Michael, and I had a question regarding future funding. Congress over the summer passed H.R. 1 that has $1 trillion worth of cuts to federal medical spending over the next decade. Of that, $536 billion is to Medicare and Medicare Advantage. I'm wondering how these cuts will affect the hospital district. Do we have a plan when these cuts start hitting over the next year? And how exactly do we build forward, especially with the latest budget proposals looking like an additional cut being proposed of 12% to the Federal Health and Human Services? Thank you.
I'm learning how to use the system here. Thank you for the question. So we are in the process of doing a new budget right now, and we will be presenting that budget over the next month or two at a board meeting, and we will have more information on that, but that is currently what we're looking at. As there's multiple areas that are unknown as far as cuts and federal funding, but we are looking at that, and we will have more answers as we continue to look at this.
Yeah, I think there was a HHSA side. I will start with briefly. Here's the way we handle these types of HR 1, and we've had some things in the past that have come up. As a county, we hear what they say, we throw our hands up and we get mad, and then we stop doing that and we start planning. So almost immediately we say our piece, we write our letters to our lobby groups, and we say, if it does in fact go into effect, how will we handle it? And I'll give you an example. I think last year in January, President Trump had an executive order stopping grants. So the first thing we did was went to all departments and said, what's your risk by dollar, by account, by program? And then how will you plan through that should the money not come? It's worked for us in the past, but specifically to the Health and Human Services, I'll turn it over to Christina.
Sorry, I don't like my back to you all. Yeah, so at Health and Human Services, we felt the first cuts of HR 1 last October. One of our major programs was cut, a CalFresh Healthy Living program. which primarily works in the schools. And so that program was cut. Luckily, we had other grants that we were able to cover those staff and that program. So we continue that program. Our next cuts will start in July. And we will have some pretty big impacts in our eligibility services, eligibility for Medi-Cal, CalFresh nutrition program. So we're looking at an additional $600,000 in our share of cost. And we will be able to cover that with our realignment, but we don't know what the next few years may look like. So pending that, we may be in a bigger problem. Right now, we don't anticipate having to cut any staff, but again, we don't know what the next few years would look like. But with the impacts come more work for our staff, so they will be overworked, and we won't have the ability to add more staff. So it really is just kind of a waiting game to see how things work out, and the most impact will be on our community, and the services that we provide will change. So more to come, but we do expect more cuts come July and then October.
Thank you. My name is Rob, and full disclosure, I recently joined the foundation board with my main interest being in looking at overseeing or looking after the new hospital construction. You mentioned earlier that right now design stands at 90% completion, and then that we're expecting to resubmit our plans to HCAI. We're going to resubmit next month. And I was wondering, is that because we need to resubmit once the design is deemed 100% complete, or for some other reason? A follow-on question is, from attending previous meetings, I understand that we don't have a Gantt chart, or what sometimes is called a critical path method schedule. So I'm wondering, what is the next major milestone, and when is it expected to take place?
Thank you for the question. For the major milestone, I'll get to that because that was the last question you asked. Our major milestone is getting through our feasibility study and then submitting our loan application to USDA loan. That is their milestone. And I know that you have asked for that chart. And Jim White is our project manager, and I wish he was here today to be able to answer these questions in more detail. But we will, I know that you've talked with him about that chart, and or you mentioned it on our ad hoc committee meeting. So I will circle back to him and maybe get you two together to really talk about that chart and get your knowledge and expertise on that and how we can meet in the middle there with that. And then your other question was HCI. It's just some of the changes that we've made. Okay.
Lower.
Yep. So just a couple of the changes that we made. It's a process that we have to submit back to HCI. There's questions, but it's a standard process. And you learn more about that as well in our ad hoc committee meeting. And then we'll be reporting out every month at the board meetings as well, more details. You're welcome. Thank you.
Question about sort of the burn rate. Question about the burn rate of cash right now. So February was bad. I know we're going to hear March numbers sometime this week. Can you give us an idea of what they look like? And right now, it seems the hospital is caught between applying for the USDA loan and also asking for HCI forgiveness. Do you think there's a risk that either of those or both won't come true? And if so, what's the likelihood of that if you put odds? And is there some kind of soft landing? And what does that look like for the hospital?
Yeah, thank you, Tom. So our financials for March look similar. And for the COP between the loan forgiveness and USDA loan, that is a true statement. Thank you for bringing that forward. So we are in the process of HCI loan forgiveness, where we can receive up to 12 months of loan forgiveness on our HCI loan. But with that, we have to, there's a question as we still have money from that loan, and what does that look like, and how are we going to use those funds, and are we going to use those funds over the next couple of months in order to receive the forgiveness? But then also those HCI fund loans, if we spread throughout time and use for different operational needs or revenue cycle or technology improvements, some improvements for growth, how does that look for applying for a USDA loan is what Tom was referring to. And so that is all up in the air, and it's a balancing act. But we are talking to HCI and we are talking to USDA loan. USDA loan is a process. They are very aware of our situation and many other US or critical access hospital. Right now, everything is on track. Our HCI loan forgiveness, we are working with HCI to help them understand that, using up all of those funds, is going to tighten things even more for us. And so really presenting a plan to HCI that will allow us to keep some of those funds and leverage them throughout the years is what our plan is. And we will know more. We're actively having meetings with them every week to talk through both sides. So I would say by next month, we would have more definitive answers on that, Tom, but it's a balancing act right now.
My name's Jim Mason.
Okay.
I retired five years ago from the emergency department at JCF, and I have a couple of questions. First of all, I don't understand how the footprint of the proposed hospital impacts the existing building.
Okay.
Does it?
I
mean, does part of the current building need to be torn down in order to put the new building in?
No, it won't be torn down. It's going to go right around it.
Okay, all right. Secondly, I know the emergency department is licensed for 5 beds, and over the years I was working there, it gradually became totally inadequate, and we're constantly having beds in the hall and patients in our little so-called triage room, which is really a closet.
Yep.
And wondering if there's going to be any increase in emergency room beds.
Yes, there is. A lot of time was put into the emergency department, and I think the community will be impressed by the thought process that went into the emergency department, working with the staff, the doctors, Rachel, the chief nursing officers, along with the nurses and the docs. Rachel, how many beds will there be? And 10, that's like that. Okay, so there's going to be 10 beds. So, okay, so that made you happy. But I think that's one of the most exciting things about the new hospital is the emergency department. So much work went into that and so much feedback. So thank you for the question.
I will let you know that when my son was in high school, he broke his wrist, and I was in that closet, and I just thought we had bad insurance. So it's interesting to know that other people were there as well. It's good to know that that's going to grow as well.
Awesome. Thank you. Stacy, Joe, Jenny, this is amazing. Thank you for doing this. Thank you for being here on a Saturday as well. To our board clerk, that's awesome. This morning I was in Wawona, and the question that was brought to me by Wawona residents, and I'll pass along to you, is, hey, we pay all of these taxes and we receive very limited services from the county because of our proximity, especially as it relates to the hospital district. It's well over an hour away. Clovis and Fresno are probably closer for them. What are ways that, thinking on the revenue side, that we could potentially offer mobile clinics for like things like behavioral health, HSA things, as well as from the hospital to generate more revenue, get more Medicare and Medi-Cal reimbursement to potentially fund the hospital district and things like that, and also use those services that we already have. Is that something that's in the pipeline? Is it something you're thinking about? And how are you assessing that? Thank you.
Adam, good to see you. I can tell you from a health and human service or from a county perspective, we're always interested in getting as many services out to all parts of the county where we can and more often. We're looking at expanding services, like example, library services into the park. I know right now both CAL FIRE and Sheriff's Office are working on MOU agreements with the park because entities that surround the park are serviced not only by Mariposa County, but by the park as well. And so just creating opportunities to deliver services. In fact, even had a meeting in Madera County, and sometimes it's easier for them to get places as well. And so those types of situations, it's not directly answering your question. I will just tell you that I'm a really big fan of regionalizing services if it helps the county. And I've used this analogy, as long as we don't become a pilot fish. So if you've ever seen the great white, and that little fish that sits on the side that eats the scraps is the pilot fish. Sometimes when we get in regional agreements, we become the pilot fish because somebody else is the shark, like Fresno or Merced. So it's finding common footing with our partners, other counties, our partners, National Park Service, but also with our residents to find out what services they'd like. I don't know, Christine had more of a dedicated answer, or Stacy, to mobile services, but certainly that's something that we're looking at. In addition, Health and Human Services is opening an office in North Campus. That's more on the Coulterville side, but it's really about understanding that town isn't where everyone lives. This is a very spread out community. We spend a lot of time getting out to people. We have mobile food delivery. So it's just one of the strategies we'd like to use, specifically for two reasons. Number one, we have a population that is over 60, and we have an isolated population. And in a lot of cases, it's difficult for people to leave where they're at to come to town for the services. So in order to make sure that they're the healthiest they can be, we want to take the services out to them. I don't know about mobile mental health. I don't know if we've discussed that. That would be more of a Christina or Stacy question, but certainly medical, we want to get further out into the community.
Yeah. Hi, Adam. Thank you. We do have two mobile units. We have one for public health and one for behavioral health. Our behavioral health is really focused on crisis, and of course, we'll respond wherever we're called. And our public health mobile unit really focuses on vaccines. So when we do have vaccine clinics, we do go to Wawona and Fish Camp every time. But of course, if there are other services that are needed, we'd be open to hearing about them.
Okay, who's next?
Hi, Lisa Parker with Native Solutions Trade Recovery Center. I'm interested in finding out about your emergency department's MAT services, and that's medically assisted treatment within the department.
Thanks for the question. And this just came up yesterday. Actually, we've been talking more about the substance abuse programs and the ED. We currently don't have an MAT program in our ED or in our outpatient. Dr. Carter and I were discussing that and would love to bring MAT to John C. Fremont and serve our community. So that is something that we're looking at. Dr. Carter's, I'm telling her secrets here, is currently in a fellowship. And so looking, partnering with an RN and really having that service here. So we don't currently have it, but is absolutely something on the horizon. That is correct. That is correct.
I was just, Christina was coming up. So Health and Human Services does it. We'll give you a very specific answer. Yeah, you're good.
Hi, Lisa. Lisa probably knows this already, but we do offer MAT services out of our clinic at CHC, the Community Health Center, where public health and behavioral health are co-located. And we also provide the service in our jail. So Suboxone. That's about it. Sure. Yeah.
Telling them to go to ER immediately. So, and then we're there picking them up or transporting them to emergency services. I think it's a necessity when they're under care and they're intoxicated and they're needing to detox. And, we're receiving the end of, that little bit of detox that they're getting from the ER services. But I'm just interested in seeing what other MAT services are going to be available on an ER basis.
Great point. And I do think that is a huge opportunity for us here to serve our patients in need in crisis. That's something that I think that we can start talking about now and really looking at that substance abuse and what that looks like. Maybe reaching out to you as well and talking a little bit more. And then, of course, the county, why we're here. But how can we help in the emergency department? And I'll have Rachel Key involved in that discussion. So yeah, thank you. Great, thank you.
Just a moment. I wanted to add something in here. So I talked about the three, the school district, hospital, and the county. There is a fourth entity in Mariposa that is absolutely dynamic, and it's our community-based organizations, our nonprofits. So you have the Alliance, you have Native Solutions, you have Mariposa Safe Family. There's a lot of them. We are also more effective when all of us in the county, hospital, school, and our nonprofits are all aimed in the same direction. So those types of questions like where can you get MAT treatment, which is a treatment for drugs, so to speak, and saying, what's that? I don't know. Yeah, it's a treatment for our individuals, but understanding in this question, you may do it, we may do it, you don't do it. So do we all know who does what? And then if we're going to do something, we all aim in the same direction so that we have a huge impact on the community because they have multiple avenues to get assistance. And it's not just for Matt, it's for a lot of other services as well. So I just wanted to thank you for being here, by the way, Lisa. To let you all know, I talked about the kind of the governmental entities, but our nonprofits and our community-based organizations are absolutely critical to this community. They have done so much work, whether it's United Way, Red Cross, I mean, not only in disasters, but also the time between disasters. So great question, and thank you for being here.
Medication-assisted treatment. Keep going. Okay, we provide it for opioids specifically to Tom's question. And so it's to help the patient safely detox and stay sober. Is that good? Okay.
You'll probably be back up here, I'm guessing. I mean, by all means, go sit down, but just be warned, be ready. So it looks like we have a couple of questions online. Can we pop back over to you, Teresa, in a minute? Okay, so let's start with Rose. Has her hand up.
Hi, everybody. Thank you so much for being here and for doing this today. I am asking as a member of our community where when we talk about all of these different services, the wonderful services that are being provided by the county, by nonprofits, by our partners, by the hospital, is there any conversation about how we can best communicate to our community and how can we really make this information easily accessible, particularly when someone is in an emergency where they don't need to go back and flip through a bunch of Facebook posts. I'm wondering how we can really make this communication very efficient and effective for those that are looking for services, just like you said, Joe, who offers what, and how can we make that more clear and easy to access for those that need it? And is that part of the conversation today?
I can start. Yes. And so over the last 5 years, We have restarted conversations with JCF. There were subsequent leadership changes, and every time someone new comes in, we say, can we coordinate efforts? I think this is the first time in a long time that we're really optimistic that we're going to be able to coordinate efforts with not only JCF, but the school district and our nonprofits to start sharing out not only a community calendar, but a community services so that people can readily find this as well. We are working on a county app, and it will be part of that as well. So there's a lot more about trying to make finding what you need a heck of a lot easier to save you time and also to put you in the right spot, in the right seat, so you get the right service. So yes, Rose, we are definitely looking into that and are moving quickly towards it.
Good to hear. Thank you, Joe.
Okay, and then Amber? Looks like your hand's up.
Yeah. Hi guys, Amber Scroggins. I know it says Warner on the screen. I am part of the Alliance, specifically the Mariposa Family Resource Center, and we partner with behavioral health services. You know, we're in constant communication with the services that are offered there. And so there is a lot of referral back and forth. How can we have a more fluid communication? I mean, we have partner meetings monthly, bi-monthly, quarterly, where we're supposed to be gathering all of this information about what's offered as like a hub, a resource center. And the hospital isn't usually a big part of that conversation. And so, or those meetings specifically, to where we have the information on what you guys are offering. How can we be a better part of communicating with the hospital? Is there a specific set of meetings that we should be attending that we're missing out on?
Amber, I think that maybe not so much missing out on, but is to, if there's already a standing meeting with the county, or if, you know, like having us invite us to a meeting, or if we can start just a regimen of meetings, a normal cadence, I think that that would be very helpful.
Okay. And then a second part is there are a lot of opportunities for grants that maybe the hospital directly doesn't qualify for, but you can lean into the partner programs like the Alliance and Native Solutions and Safe Families to help kind of navigate those services, much like Lisa was asking about, you know, that we might be able to seek out funding and partner that way, and you could utilize some of our individuals who are really talented in seeking opportunity. And so I just want to invite you guys to reach out and encourage you to give me a call, or Hallie, or you know, Lisa.
We will definitely reach out, and we will take every opportunity of grants that we can partner with right now. So thank you.
Thank you.
Just a side note on grants for the public. In a lot of cases for our nonprofits or non-governmental agencies to get access to grants, they have to almost be sponsored, whether by the county, the school district, or the hospital. So we may see a grant come in and say, well, we certainly, this is, you know, this isn't something that we're experts in. We have experts in different nonprofits, or the nonprofit sees a grant. And what happens is the county signs up as a partner to demonstrate to the loaner or the giver of the money that it's going into an organization that's structured. Obviously, nonprofits tend to be a lot smaller than the county government or the hospital or the school district. So nonprofits in a lot of cases will come to the county and ask us to sponsor on, and we do that frequently. And it's one of the things. And then the second piece of that is when we do sign off, a lot of times we're the oversight. So the county reviews whether financials or performance or things of that nature to make sure that what comes in is actually going to who it's supposed to go to, and then it's being done efficiently.
Thank you. I wonder if we could kind of go back to Jenny's story about the swing vets. It
Sure.
seems, looking at the demographic of certainly the people who show up at these meetings, they are older folks who may need a swing bed or something that's, well, it's true, right? I mean, come on. If you think about the services that the people in this room will need,
Gotta love Tom.
it is skilled nursing, it is a kind of swing bed. Those are the scenarios. And I know there's even a wait list for the swing unit, Ewing Wing. Can you kind of just take us through that? What is the backlog of that? And what does that look like in the future in terms of building that out? Because it's simply demographics, which way this county is going. Because
Yeah,
that's the reality.
yeah. And I will look to Rachel Key to chime in if I'm missing any information on this. Or Rachel, if you want to go ahead and take that, you please. Thank you.
Sure. The Ewing Wing it is something we do really well, and we do have a wait list, around 15 people right now. The last I checked, it was 20. Now, we haven't gone through the entire wait list and see who actually could be there. Some people, it's not appropriate to be there, but that's one of the reasons in our master planning, we recognize that we would like to add more beds.
And Rachel, in our master planning, there were 2 different exhibits and one was 24 beds,
Yes.
right? So up to, because right now we have 16 residents, so it'd go up to 24 residents. And then the other one was,
I thought it was 20,
or
or maybe it was more.
30 some, I think, in the one.
Oh, I don't remember 30.
Yeah, in the 2 different exhibits. But more. So it's just, exactly. So the wait list of 15 to 20, and then what does that look like in 5 years from now to be able to serve our community?
And we've even had more on the wait list, and some people have given up, or, they give up and just go somewhere else. Fresno, Merced. So.
Yep.
Yeah.
Thank you for the question, Tom.
And can I add something to that, Tom? Let me come up here. Because you mentioned the swing bed. Swing bed is different than the skilled nursing. So that the swing bed, anybody can be at any hospital, be discharged, but still need care, like physical therapy, IV treatment, wound care, infusion, any sort of thing like that. And typically, if you're at a different hospital, they'll just say, okay, go down the street to so-and-so place, Merced, Modesto, Fresno, because we don't know any better. And we're just trying to get you out and, get the bed open for the next patient. So the swing bed, if you or a loved one, family members at a different hospital in that situation, you can vocalize that you want to recover back home in Mariposa in our swing bed program, which is in the acute care unit of our hospital. So that's an opportunity we have that, again, most people don't know about. So I want to take a minute to mention that. Yes. Thank you.
Thank you for the clarification.
And by far the best care that my father received was up here in that swing bed at John C. Fremont Hospital, by far. And we were in many, many, many emergency rooms, many, many rehabilitation centers. It was a nightmare until we got him here. So I really want to commend you guys for that. And Rachel, so.
If they're on the wait list and it all works out. Yeah. Mm-hmm. Yeah.
I have a question back here.
I want to go back to the Matt comment and question. Stacy, I'm sorry, I forgot to introduce myself. I'm Teresa Johnson. I am one of the 5 members of the board of directors for the hospital. And speaking to my CEO, I would like to reference you back to that Matt question to give them an idea of the special clinic we've been talking about as we were planning the new hospital, to at least begin people at the right place with the right help.
Yeah, thank you, Teresa. In the new hospital, or in the master planning build, our current existing ED, after the new hospital is built, that whole section the small section, as you referenced, people in the hall, but taking that section of the hospital and turning that into a behavioral health where people can go to receive more medication, some services that are kind of urgent needs, but not emergency care, where it's more of a clinic setting. And that also could be something that could tie into an MAT situation in the evenings and that kind of thing. So just kind of treating that population, because right now what happens is our ED is impacted by people in crisis. And so, can we help those people before they're in crisis? Can we work with the county? Can we work with the track team? All of those things to help our community and maybe send them home. They don't have to sit in the ED. And I mean, if they're in true crisis and they need to go to another facility, that's a different discussion. But just helping those people in need that maybe need some medication or, just some services, but not emergency treatment where they need to go on to a different facility. Yeah. Did they answer that, Teresa? Thank you. Thank you.
So Stacy, I know that Fremont is desperate for cash. There's always a shortage of cash. And in the past year, because of the billing problems that are separate from maybe an NPI number problem, but with all the billing problems, you've missed out on over $6 million in cash collections. What is your plan to correct that?
That's a great question, Suzette. So we are actively working on our billing. Our new billing company was taken on a year ago. It takes some time to look at what processes we set up when we started a new billing company, and then accountability to a new billing company. And so me taking on this role, I'm right in the middle of it. They've been here a year. Lots of things that we're identifying. And there's, talks and plans, preliminary things. But it is definitely on our radar, Suzette. We are working on it. I will have more information to share as I can. But the one thing I do know is when we take on new billing companies, there's foundational pieces that we have to fix internally. And then there's also discussions on how your revenue is going to flow. And then when I don't want to get too technical, but then when you get claims go out the door for a clean claim to get revenue, and watching that process and testing that process. And so we're doing some of those things now, and it's a year into it. And then furthermore, having some accountability and looking at contracts and things like that. That is correct. They are a billing company.
That they're doing.
Yep.
What does that mean also in terms of what that's the burn rate of money? We're kind of going down the road, we're burning money, we're not collecting it.
Mm-hmm.
What are you doing to kind of hold their feet to the fire?
Yep. So we have set up weekly meetings, having more crucial conversations, and then also potentially, thinking of other solutions and bringing other things to the table. Maybe more bringing things back home and things like that. And I don't have all the answers today. I'm not, prepared to talk about all of that, Tom, but I'm fully aware. I understand what everyone is saying. That is my question. And there are lots of exhibits moving forward that can share that we're aware of the issue. We're working on the issue. And if it doesn't change, we'll make some changes.
If I could just jump in real quick on this one. This isn't a unique issue. The state of California has been devastating when it comes to making the payments to their clients, so to speak. So even as a county, so revenue cycle management basically is you do a service, let's say it's a Medi-Cal service, and we bill the state. The state may take 9 months to pay us. It's right. So, and this, I'm not even kidding about this. They may take 9 months to pay us or even longer. Now, when you're a county government, you don't have a cash flow issue because it's the government. But assume it was your own business. Imagine you made widgets and you sold them all, and you sold everyone that you had, and then everybody that was supposed to pay you took a year to pay you. How hard would it be to continue your business for that year while you're waiting for payment? The California state government changed the way we do our specifically Medi-Cal work. We now send them money. They draw down federal money to, I mean, it's a total new system. But most counties, including our own, have struggled with getting our payments for Medi-Cal. What happens at the hospital, though, is they're not the government. They have cash that they use to keep operations rolling, and that becomes where the stressor is. Now, the county has gone through multiple different billers, different types of ways to do billing so that we can even be effective. The Medi-Cal environment today is incredibly, I won't say broken, but it's getting close. It's pretty rough to do business with the state of California, because even if you do, as an example, $9 million worth of behavioral health services in a year, you know, you'd be lucky to get 7, but after they take out the errors, it's 4, and then they send it to you 2 years later. And so it's a difficult environment. And so some of the answer, I think Tom didn't ask me the question, but some of the answer is, some of it is the state. What that means for us is, and specifically at the county, we have to be awesome to survive. And that's where some of the conversations with the hospital have been of, let's have our fiscal teams talk to each other. How are you doing it? How are we doing it? Who's most successful? Because if we do it really, really great, it's still not going to be good, meaning what we get. But we need to be really great in order to be efficient enough to survive.
True, but that's the 6 million Suzanne's talking about is about billing, it's about award burden, it's about the money before it even gets to the feds for reimbursement from Medicare and Medi-Cal. It's not about money coming back in reimbursement, it's about money not getting out the door, correct? Lovely dissertation on that, no, sorry guys continue, but I don't think it's the issue that was asked about. I'll let Stacy answer.
It was more about cash flow, Tom.
And it's both, Tom. So Joe, thank you very much for chiming in there. It is both. But to Joe's point, we have to do this great. So that is requiring us internally to we have to do great, and we have to be awesome internally. And that's the point. We have to have our foundational pieces fixed. And that is what we are doing currently. Yep. Yeah, it's both, Tom. It's both. It's not 6 million exact hard cash going out the door. It is both. It's a high number, but it's mixed. Yeah.
You have to use a microphone, Tom. I can't run that fast in heels, man. Okay. I can do burpees in heels. Oh, okay. You got it, Zach. Got another question from Michael. We're getting close here, folks. We're at 3:40, so.
Hi, this is Michael again, and I just have a quick question. Given the challenges going on with the payment, given the challenges going on with federal funding cutting, and given the challenges going on with having to build a new hospital to meet state requirements, it seems like we're having a perfect storm of financial issues. What is your confidence, if you had to say 80%, 90%, what is your certainty that a decade from now there will be a public hospital in Mariposa County?
I am confident that there will be a public hospital in 10 years in Mariposa County. From the beginning of my presentation, thank you. I'm like, I just want to be clear. In the beginning of my presentation, like I was clear. This is not easy. This is really hard, and this is the first step: is talking through it, and laying out the foundational pieces and sharing this out. And I will have more every month as we move forward. And there will be wins and small wins, and there's challenges along the way. But I am confident that there will be a hospital.
Okay, any further questions from anyone before I say a couple of things? I think we're good, huh? So I really want to say thank you so much to Joe and Stacy for coming today and being part of this conversation. I think, like Stacy said, this is the first step in continuing to be at the forefront of the community and helping you guys really understand that we have a group of people here who want to do the best they possibly can inside of that hospital, on that hospital board, sitting before you today. All of us want nothing more than for this hospital to succeed, our community to succeed, to work collaboratively together. I think Stacy's the one that's going to lead that path for John C. Fremont Hospital. I believe that deeply, having spent quite a bit of time with her here recently. I think we're going to actually wind up being really good friends. So yeah, she likes to do her hair and stuff, so it's fun. Anyway, not to make jokes, well, kind of to make jokes. You got to make some jokes, right? Dr. Christina Kahili is doing a fabulous job at HHSA. Stacy Lynch also got to spend some time with her. I think we've got Rachel Key. You heard Joe. I mean, Joe's great, right? We're lucky. Some interesting change has occurred in Mariposa County, and I think we're going to see some positive changes for sure, because you have hungry, passionate people that love Mariposa County and want to see it succeed, and the hospital isn't separate from that. I don't serve a different constituency base than Stacy serves down there at the hospital. Rachel serves inside of those swing beds. When my father was in the hospital, I wasn't Jenny Kaiser, the supervisor now at JC Fremont Hospital that's not inside of Mariposa County anymore. I wasn't, right? We're all here trying to make the best of this. So, I just want to remind everybody in true Jenny JK fashion, be nice. Let's be nice to the people that are doing the work today, because they're doing a really, really, really good job. And we're not going to get it right all the time. We're not going to get it right all the time. Feel free to call me out on anything. I'll admit when I screw things up. I'm a professional at not only screwing things up, but making it right. And so are all of you. We're all humans and none of us get it right all the time. So thank you so much to the hospital board who is online and also here. I've got Jesse Bullis in the room, Teresa in the room. I know Rose is online. Everybody has, I'm not sure of the other members online because it's like it's 2 letters, so I'm not sure who they are. And thanks to all of you for coming and being a part of this today. Have a wonderful rest of your Saturday.